Anjum, I'm so excited that you can join us here today. Thank you.
Thank you for having me. I'm excited
So,
to be here.
we often think about Canada as an oasis of equality and all those good things, right? But we're increasingly finding that there are health inequalities for individuals who are from racialized communities. How do we understand that?
Yeah, that's a great question. And I think often the reason why we think this is because our neighbors to the south, it's so blatant, and we've heard a
The
lot.
racism is blatant, yes.
The racism against different communities of color. But when we look at the history of Canada, we aren't that different when it comes to how we've treated South Asians, the Chinese Canadians, and of course our Indigenous brothers and sisters and our Black brothers and sisters. So we have the same history in Canada. It perhaps looks different or operationalizes differently. But when it comes to health inequalities, that's just following some of the differences we see when it comes to social and economic outcomes. So my background is in public health, and one of the things we talk a lot about is the social determinants of health. So things that impact our health and well-being that are not necessarily just access to healthcare. So things such as access to housing, good jobs, decent working conditions, access to income security. These are all things that actually make a measurable impact on your health and well-being. And what we're seeing is in Canada, communities of color don't have the same access. So there's a term that's often talked about, which is called the healthy immigrant effect. And essentially, it's this concept that's been proved by data that when people first immigrate to Canada, they're actually much healthier than the Canadian-born population. But over time, their health and well-being declines, and it's lower than the Canadian-born population. And it's because they don't have the same access to employment and work and income. And so it really shows you how all these other factors that racism is sometimes linked to actually can impact your health and well-being as well.
Can you tell me a bit more about how race would impact health?
Yeah, so racism has this, it can actually get under your skin.
Okay.
So there's many different pathways, but one I share is that the fact that, for example, and we've seen this in data around gendered Islamophobia or Islamophobia in general, that the mental health impacts of thinking that you might be discriminated against or actually being discriminated against, that can actually increase your mental health symptoms. It can actually impact your physical health symptoms. So
is it sort of like a trauma?
Exactly, yeah. And so just that fear, that flight or fear response, that actually increases the cortisol levels. And so if your body is always on edge that something might be happening or something does happen, that actually increases your negative outputs there. And actually, there's a study from the States that actually tracked Iraqi refugees after 9/11, and they actually saw a marked increase or correlation with cardiovascular outcomes that were negative for health.
Now, what about the fact that certain communities have certain diseases that are more prevalent than others? How do you explain that, or what do you do with that?
Yeah. So so racism is this very complex issue and a complex phenomena. So what helps me break it down is actually thinking about it in different domains. So for example, there's interpersonal racism. So that might be racism that someone experiences perhaps on the street or in the workplace, that one-on-one experience of negative interaction. You can also experience internalized racism, where if society is telling you that the community that you're part of is less than or has experienced or it doesn't deserve the same opportunities as other communities, that can actually start to impact what you think you're actually eligible for or what you should have in society. And then there's also institutional racism. So a great report actually in Canada was this report that the Wellesley Institute did, which looked at the experiences of Indigenous people in Canada. And it's called First Peoples, Second Class Treatment. And I think that actually starts to highlight why we see certain negative outcomes in certain communities, because for some reasons there's actually a lack of access to good services. So in the healthcare system, for example, if people, when they go into a healthcare setting, find that people are not speaking the same language as them, or they're being treated with disrespect, or that when they actually say that something is happening to them but it's not being taken seriously, that can actually reduce their access to services on time, and then the types of services they get as well.
And I understand even for example, for referrals or for specialist care, that people from racialized communities are less likely to have access to that sort of care.
Yeah, and I think sometimes it comes down to trust as well. So if the healthcare system has been treating certain communities with disrespect, and they say, oh, finally, after a very long time, here, you can go and get this referral, but that referral doesn't seem inviting, or people are not speaking the same language, or people that look like them are not in those spaces. Representation, I think, is also a key piece to the puzzle when it comes to addressing racism in health and healthcare.
Yeah, I think that if somebody is from a different community, they might not understand, for example, how you respond to pain.
Exactly.
There are a lot of different things that they might not understand.
Yeah.
Or, for example, if you come forward with a domestic abuse sort of claim, they might blame it on your religion or your culture, which can be offensive.
Absolutely.
So that creates a barrier for an individual to access healthcare.
Absolutely, and I'm glad you brought up that piece around different cultures. So there's research that shows that different cultures might actually experience mental health symptoms differently. So it might not be in how you traditionally think about anxiety, but it might be body pains, for example, or it might be lack of appetite. So there might be different symptoms that show up for different communities.
So to give you an example, when my brother had a serious injury and he was in the hospital, the doctors thought that something must be wrong with him because he wasn't responding in a devastated way, because he had an acceptance that, okay, God did this, so he just accepted it.
Absolutely.
But they thought, maybe he was in denial or something is psychologically wrong with him. So they wanted to do an assessment.
Oh, wow.
But, it's just his faith, that's just how he is, and that's how he understood his faith, that, God was doing this for him. So the doctors couldn't understand this,
Right.
So there was a barrier there.
Absolutely, and I think that's why diversity and representation in our healthcare system that actually represents the communities that they're serving will be a key part of the puzzle. And I think that's something where Canada can do a lot to look at racism as a public health issue and its role that it can play to address and mitigate it.
So let's talk about language barriers, because I find it very strange that, someone would go to a doctor or a hospital and they wouldn't be able to speak to the doctors, or the doctors wouldn't be able to speak to them in a language that is mutually understood. So basically doctors speak in English, and the patient has no idea what they're saying.
Yeah.
That seems really strange that we would allow that to happen in Canada.
Absolutely, and actually in the city of Toronto, where we're at right now, is one of the most linguistically diverse cities in the country. And so depending on what part of Toronto you're in, sometimes you might have access to an interpreter, but that's often, let's say, in a hospital setting. But if you go to any family doctor, that's not necessarily the case. And for us, there's certain provisions in the law, for example, that if you're accused of a crime, for example, or need to access the legal services, you actually are required to have access in a language that you can understand. But what we see is that it doesn't extend, for example, to the healthcare system, which in many ways is a life or death situation. If the person that's providing the diagnosis doesn't have all the information, how can they provide a diagnosis that actually addresses what your concerns are? So I remember a story that one of my colleagues had once told me, and he's a physician by training, and he was saying, for 4 or 5 weeks in a row, there would be a patient that would keep coming to the ER that he worked at. And every single time they would prescribe medication. And what they realized afterwards, after the 4th or 5th time, was that the person that they were prescribing medication to was taking it, but because they did not have food on the table and had a low income, they weren't actually eating. That actually impacted their ability to take the medication in the way that's supposed to be taken. But all of this could have been understood if they had actually an interpreter, because there's a language barrier there. They weren't speaking the same language as the patient. And so they weren't getting all of this extra data about their actual everyday experiences that would have actually helped them support them in the first place.
Now, we often talk about patients, but what about healthcare professionals? Because we haven't spoken about that, but they also experience some prejudice, some racism. Can you talk about that a little bit?
Absolutely. So in some of my past research, I looked at the experiences of healthcare workers that were working in our long-term care homes as well as in home care. And one of the things that I think about is, for example, our personal support workers. They're supporting patients at the most vulnerable times in their life. But what
And
we
their work
don't-
is tough.
And their work is
Yeah.
tough, long hours, really
Very
intense
physical work, yeah.
physical work. But then they are also experiencing, and they're on the brunt of, sexual harassment, racist slurs, verbal assaults. And so, we talk a lot about the experiences of the patient, and we need to address the healthcare system so it fits them. But we also have to think about, communities that are working in the healthcare system that is safe for them. Actually, I think just last year, there was a huge incident in Mississauga where one patient in particular was refusing care from a Muslim doctor just because of their religion, or also because of their race. And so those are some of the things that we also need to address. Because as we increase diversity in the healthcare system, how do we ensure that people of color are supported when they do this type of work?
What about socioeconomic factors? Because poverty plays a role as well. If somebody is from a racialized community but is also, let's say, has living conditions that are, suboptimal, or, for example, doesn't have a job where the working conditions are good, or healthy.
Yeah.
So that impacts one's health as well. Can you speak more about that?
Absolutely. So I actually did a lot of organizing and advocacy around pushing for paid sick days in the province of Ontario. And for me, it's a no-brainer in the sense that if you're sick, you should stay at home. You shouldn't be asked to go to a doctor and get a note and then make other people sick as well, make yourself sick in the process. I think one of the challenges is that what we've seen is that for racialized communities, there's research that shows they're as educated, or if not more educated, than the non-racialized population, but they don't get jobs that are connected to their level of education or level of experience. And so what they face is a lot of, shattered dreams, so the mental health impacts of not actually working a job that you studied for, but also not getting good pay, not getting decent working conditions, not getting things like paid sick days, or benefits. These are all things that when we think about employment, we have to consider. It's pay, but it's all of the other things around it as well.
Anjum, what are your recommendations for making healthcare more equitable?
Yep, absolutely. So I think public health and healthcare, there's three main things that they can do. I mentioned a bit about this before, but critical research. So unfortunately in Canada, we have a data deficit. So
Unlike other countries, right?
Yeah, yeah. And so in the US, actually, this is where we see actually a lot of promise in the fact that they have disaggregated data. So you can actually look at, let's say, maternal mortality rates or death rates or any health outcome, and you can actually see which communities were impacted by race, by income, by all these different factors. But the same can't be said for Canada, for example. So I would say critical research and actually getting better data to address the data deficit. Part of it is also we need to do internal reform, so our healthcare system. So we shouldn't have to face challenges when it comes to accessing services because our language is different from English or French, for example. Those are key pieces, diversity and representation. So at the University of Toronto, actually, they've done some great work around increasing diversity in their medical student population. So they have different streams to encourage more diverse community members to join, such as Indigenous community members and Black community members. So that internal reform piece is a must. But I would say one of the things that the healthcare sector has is that they have privilege. People, when they hear from someone who works in the healthcare sector, they listen. So why not use these platforms to talk about issues like racism and address it at a systems level? So back in 2016, actually, the province of Ontario established an anti-racism directorate. So the role of that in government is to look at all policies through that race lens to see, okay, who does this impact? This policy, how does it impact different communities, and what can we do to mitigate the experiences of racism? So I think as people in healthcare, we also need to look upstream because often when people come to to the healthcare system, they're sick already. But part of the work of public health is to ensure that people aren't sick in the first place, that they live happy and healthy and thriving lives. So I think part of our role is to work upstream to prevent issues from happening in the first place.
Let's talk a little bit more about internalized racism, because people who have, let's say, mental health issues, they might feel reluctant to go to health professionals with their concerns. There's a reluctance to seek care.
Absolutely.
So, what are your thoughts on that?
Yeah, it's really complex because part of it is you want to perhaps seek help, but you don't want to be labeled, or you don't want to bring shame to your family, or the stigma, or those are some of the things that I hear about in different communities that I work with. Part of it's also when you do actually seek help, are people understanding the space or the experience that you're coming from? So for example, I know at the University of Toronto, there's a great mental health professional, Dr. Tayyib Rashid, who does a lot of work with people of color, because sometimes, if you're going to a healthcare professional that doesn't have the same family experience as you, the same religious experience as you, et cetera, when you tell them, it just makes your community look bad. So that's one of the challenges. And so often what we've seen is coping mechanisms people use, whether it's, substance use or, negative behaviors, people rely on that because they can't get access to the services they need, so they're perhaps engaging in negative coping behaviors.
Now, what about young people? Do they experience racism in public health more than other populations?
I think it's interesting. In some ways, I think because there's more awareness now in our generation compared to previous, people are just more aware.
The older generation might have dismissed it, but younger people are more, they know it when they see it, right?
Yeah, and they might be actually sitting with the issue more. I think one of the good parts is that perhaps then they can build community more, because maybe people are more open about it and they can talk about it more. I think the challenge though is that because of, let's say they're a millennial and they're in the workplace and they're experiencing issues, they might have less power to actually speak out. So those are one of the challenges. They actually recognize the issue more, so there might be more uptake of resources, but they might actually be not taken as seriously. So those are some of the different challenges. And I think one of the things, and we talked a bit about this around how health is impacted not just by your access to healthcare services, but also your access to other things like employment and housing and income. And so young people might actually face barriers to accessing things that would actually enable their health. So those are some of the challenges as well, because we hear a lot about precarious work, for example, and millennials having, XYZ degrees, but it's actually getting harder to get into the workplace. I think those are some of the things that they're dealing with as well.
Now, Anjum, you've talked about recommendations, and those are, high level. But what about for, you and I, the average person out there? What do you recommend they could do to improve the situation?
I think the biggest thing is to not be a passive bystander. So when you see instances of racism, when you see people saying things they shouldn't, whether it's online or in person, actually speaking out.
It's often indirect racism. That's the thing.
Yeah. I think part of the challenge is looking at whatever place that you're in, you have the opportunity to make change happen. So when I was at school, for example, I noticed in our public health faculty, for example, there's no courses talking about race or ethnicity or immigration in a really meaningful way. And so we actually advocated, and we were able to establish a course looking at ethnicity and culture and race and racism and how it impacts public health. So there's a way that you can, look at the environment that you're in. It could be as simple as in your workplace doing a lunch and learn, because, issues of racism and Islamophobia are becoming more and more top of mind in Canadian society. So actually doing a lunch and learn, where it's not just you, maybe you bring someone else and you can just do a quick workshop. That's something that you can do. But I think not being a passive bystander is key, like actually actively using whatever power you have. So if you're in a situation where there's a sexism happening, and if you're someone who's not a woman, you can actually say something, and there's a way that you can actually address the issue, because all of these things like racism, sexism, they're all integrated and interconnected.
Anjum, I'm really happy that you joined us today. Thank you.
Thank you very much for having me.
Oh, you're very welcome.
Thank you.